during his much maligned debate against Vice President Kamala Harris, former President Donald Trump talked about his healthcare plan. Well, more like he's got concepts of a plan. He had 9 years to come up with a plan, and he's just got concepts of it. Okay. However, Republican vice presidential nominee J.D. Vance ended up sharing one of those concepts, which would be part of any hypothetical Donald Trump Vance healthcare plan. And, well, it's not good.
What President Trump's healthcare plan is actually quite straightforward. Is you want to make sure that pre-existing coverage conditions are covered. You want to make sure that people have access to the doctors that they need. And you also want to implement some deregulatory agendas so that people can choose a healthcare plan that fits them. Think about it. A young American doesn't have the same healthcare needs as a 65-year-old American. A 65-year-old American in good health has much different healthcare needs than a 65-year-old American with a chronic condition. We want to make sure everybody is covered, but the best way to do that is to actually promote some more choice in our healthcare system and not have a one-size-fits-all approach that puts a lot of people into the same insurance pools, into the same risk pools, that actually makes it harder for people to make the right choices for their families.
Oh, okay. So, of course, his plan is deregulate the insurance markets. Yeah, because they're famously overregulated or something. No, here's what that means. We would be going backwards. This isn't a new plan. This is just bringing it back to the time where before the ACA existed. Look, insurance companies would be once again be able to deny coverage based on pre-existing conditions. That's what deregulating the market actually means. That was one of the things in the ACA that actually made it decent. Because prior to that, you couldn't get healthcare coverage except through Medicare, Medicaid, which again, Medicare, you have to be 65 or older. Medicaid, you have to be extremely poor, or if you're lucky, to get it through an employer-based plan, if you had a pre-existing condition. But regardless, you would still end up in a high-risk pool. Now, that high-risk pool is much more expensive. Right now, health insurance is still expensive, okay? But for people in the high-risk pool, it was unaffordable. So those high-risk pools basically face the real possibility of going into a death spiral in which you have so many, you have people that can no longer afford their premiums dropping off, which makes premiums higher because the pool is much smaller. And so on and on until it shrinks and collapses in on itself. That's the problem. Now, of course, younger people would end up paying a little bit less because younger people generally don't have to use their insurance. That's why they get lower rates, right? However, older people, people with pre-existing conditions would end up being screwed more so than they are now. Because right now, the law still allows insurance companies to bill older people up to 3 times as much as they do for younger people, right? And so that's one of those things where it's like, well, insurance companies say, well, I mean, these people are expensive, man. You know, okay, yes, we'll cover them, but you got to allow us to at least triple the bill. I mean, so that we can cover them, okay? And, you know, ACA, the designers of the ACA were like, oh, okay, yeah, go ahead. You can only charge them 3 times as much as you do young people. We'll give that one to you, all right? Look, I think the current system that we have, which is public, private, whatever, mostly private, I don't think it's good. I think we need a Medicare for all system to cover primary care. And I do see a role for private insurance to cover things that are elective. All right? So things that are not required for a human being to live. Okay? That said, that's what I want. I know I'm not going to get it. Okay? I'm still going to fight for it. But Medicare for all is just superior to what we have now. That said, what we have now is still better than what J.D. Vance and Trump want to go back to, okay? Where thousands of people ended up dying as a result of not being able to afford health care. In fact, one of the things that the ACA did that was great was have a Medicaid expansion. Now, Republicans fought against that and made it so that states, if they didn't want to, they didn't have to expand Medicaid and expand eligibility specifically. Now, that has had disastrous results. Now, it turns out, according to a study from between the years of 2014 and 2017, 15,600 adults aged 55 to 64, which is in between being able to be eligible for Medicare and still ending up in these high-risk pools, died prematurely because of state decisions not to expand Medicaid under the ACA. In the states that did expand it, guess what? They saved the lives of 19,200 people at least. So understand that these are people that are either in or would be put back into the high-risk pool without the ACA and the Medicaid expansion. Remember, that is something that J.D. Vance and Donald Trump want to roll back, okay? So now I believe that healthcare is a human right. It shouldn't be tied to your job. It shouldn't be tied to your income. Regardless of who you are, what you are, you should get the same healthcare as everyone else, and it should be good healthcare, okay? And so I've got issues with the ACA. I have an issue with it being a handout to insurance companies that leaves too many people out. But I don't want to go back to seeing thousands of people die a year from not being able to have health insurance. And that's exactly what this would do. That's the price, though, that J.D. Vance is willing to pay to appeal to young people so that they don't have to pay as much for health insurance, okay? He's going to let older people and those with pre-existing conditions end up in a literal death spiral, okay? Again, both literal and figurative. The health insurance market going into a death spiral, and then these people who don't have health care have their own death spiral. And this is all while insurance companies are able to make huge profits as a result. That is the system that J.D. Vance and Donald Trump want to go back to. They don't have anything new here. They just want to roll it back. Their concept, oh, we've got concepts of a plan. No, his concept of a plan, his plan is to just go backwards. Look, here's the thing. The conservative worldview is not that we can't insure everyone because we can't afford to do it. No, we can't afford to do it. It's actually cheaper. The thing is, in the conservative worldview, that would be a bad thing. They don't want to. Conservative think tanks have pointed out Medicare for all would actually cost less and save more lives. Yeah, I know. Crazy, right? But that's what would happen if we went to a universal Medicare for all system. But see, conservatives, their entire argument is, yeah, but we can't do that because poor people don't deserve health care. It would create moral hazards. If we allow people who don't work or who are too poor to afford health insurance to be able to live and get health care. We can't have that. Why? Why can't we have that? I don't know. I'm not a conservative, okay? I don't understand why people should not be able to have health care. I don't know. But they look at this, they look at Medicare for all, they look at things like even the ACA and are like, nope.
Can't let that happen.
Can't let poor people get health care. No. They should not be allowed to have health care. Only if they're rich and have generated a lot of profit for a few individuals will we allow them to live. That's a pretty effed up worldview, all right? It is selfish and absolutely repugnant. However, this is the system that they want, and this is the system that if they win, they will go back to. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.